وهي Oromia ጤና ቢሮ Oromia Health Bureau Public Health Emergency Management Laboratory and Research Directors. Marburg Virus Disease IMS Daily Activity Update Ethiopia Oromia November 25, 2025. Introduction to Marburg Virus Disease. Marburg Virus Disease, a severe hemorrhagic fever, often fatal, caused by either of two closely related viruses. These are Marburg virus and Raven virus, which are closely related to the Ebola virus. MVD has a high case fatality rate ranging from 24% to 80% from previous outbreaks. The case fatality rate can be lowered with good and early patient management. MVD transmission initially transmitted to humans from African fruit bats, Rosetas aegyptiacus, natural reservoirs. Then spread among people through direct contact with bodily fluids, contaminated surfaces, or infected materials. At high risk, healthcare workers, caregivers, traditional healers, religious fathers, community leaders, and individuals involved in burial practice are particularly at risk when infection prevention and control measures are not in place. Clinical manifestations. MVD symptoms typically begin abruptly after an incubation period of 2 to 21 days and include high fever, severe headache, malaise, muscle aches, and progressive gastrointestinal symptoms such as diarrhea and vomiting. In severe cases, patients may experience bleeding from multiple sites and die from shock and organ failure within a week of symptom onset. Core pillars in EW and preparedness. Coordinations. Multi-sectoral coordination and pillar meetings at all levels. Sharing of detailed situation reports is encouraged. Involvement of different stakeholders and partners. Resource mobilization efforts within the government and with partners are recommended. Risk communication and community engagement. Raising public awareness and engaging with communities. Raising awareness of symptoms, risk factors for infection, protective measures, and the importance of seeking immediate care at a healthy facility. Sensitive and supportive information about safe and dignified burials is also crucial. Special attention should be given to high-risk groups such as traditional healers, religious fathers, and community leaders. Misinformation and rumors should be addressed to foster trust and promote early symptom reporting. Surveillance. Active case detection, contact tracing, and alert management across affected and neighboring regions should be intensified. Community-based surveillance systems should be strengthened to promptly identify and report new cases, particularly in high-risk areas. Close monitoring of healthcare workers, family members, and individuals who have had contact with suspected cases or other high-exposure settings should be ensured. Surveillance capacities should also be intensified at relevant points of entry and borders to reduce the risk of further spread. Marburg Virus Disease case definitions. Source: EPHI material. Standard case definition for MVD cases. during outbreaks. Suspected case. Any person alive or dead, suffering or having suffered from a sudden onset of high-grade fever and having had contact with a suspected, probable or confirmed Marburg case. A mine or caves, travel history to outbreak areas, or any person with a sudden onset of high-grade fever and at least 3 of the following symptoms and travel history to head outbreak areas: headaches, vomiting, anorexia or loss of appetite, diarrhea, lethargy, stomach pain, aching, muscles or joints, difficulty swallowing, breathing difficulties, hiccups are the main common symptoms. Standard case division for MVD cases during outbreaks, or any person with an unexplained bleeding or any sudden unexplained disease. Standard case definition for MVD, probable case, any disease suspected case where it has not possible to collect specimens for laboratory confirmation having an epidemiological link with a confirmed case. Confirmed case, any suspected or probable case with a positive laboratory result. Community case definition, any person with a sudden onset of high-grade fever or any person with non-traumatic bleeding from any site or any disease case of unexplained cause. Contact tracing and follow-up. Standard definition for contact person of Marburg virus disease case, and a person who interacted with a symptomatic Marburg virus disease case, suspected, probable, or confirmed in at least one of the following manners within 21 days. 1. Touched body fluid of the patient, that means blood, vomit, saliva, urine, feces, semen, breast milk. Had direct physical contact with the body of the patient, alive or dead. Touched or cleaned the linens, clothes, dishes of the patient. Slept or ate in the same household as the patient. Activity done so far in Marburg virus disease outbreak, early warning and preparedness. Coordination. PHEOC, alert mode. EPRP, prepared, shared with stakeholders. Team deployed to investigate rumors and readiness assessment. RCCE, draft RCCE plan, prepared and community establishment. Marburg virus key message, prepared and disseminated. Oromia Communication Education Bureau, OBN, awareness to community via OBN, social media, TIGBA, OHB, FB. Rumor received via 6955 hotlines with WhatsApp group channel. Rumor addressing via media outlets. Orientation to different party, that means community, healthcare worker, officials. Activity done so far in Marburg virus outbreak, early warning and preparedness. Surveillance and laboratory alert notification to respective zones and the down structures. Health facility orientation to PHRRL staffs. Laboratory PPE guideline and triple package distributed to PHRRLs. Active case searching in places, case definitions and reporting formats availed. Contact tracing undergoing sample collection and shipment to EPHI. That means 3 suspects. Rumors, source of rumors, community, traditional healers, health facility, sector, mining company, hotlines, media scanning. Received rumor should be verified as much as possible immediately after notification. detection of a rumor or information, verification, public health surveillance team RRT deciding whether the rumor fill criteria for being suspect and eligible for lab sampling. 3. The proactive cross-checking of the validity of the rumor collected by contacting the original source, additional source, or by performing field investigation if the information is deemed credible and suspects a potential health event. It is flagged as a signal. Here is a table, rumor identified in the investigation. Follow this table, please. RC Zone Rumor Investigation. An investigation was initiated after a rumor circulating on social media reporting the deaths of 11 named individuals from Marburg Viruse in Huluko, Kabele of Aseko, Wereda. Field investigations findings. Following the 11 Marburg Viruse reported on social media along their names, we consulted community leaders, residents, elders, and religious leaders, but none of them were identified. We interviewed 3 individuals in Huluko, Kabele, 1 current ill, and 2 who had previously been sick. 2 community deaths were identified in Huluko, Kabele 1 month ago, age 33 years and 68 years. Ribu Ketema Kabale, adjacent Kabale, we identified certain individuals who were ill. Major signs and symptoms reported at both Kabales: headache, malaise, myalgia, fever, chills, and rigors. Huluko and Ribu Ketema Kabale. Also, we observed critical hygiene and sanitation problems during visit. Activity done for Marburg virus. Activity done so far in Marburg virus disease outbreak, early warning and preparedness. Isolation and case management. Case management guidelines shared to all hospitals. Cluster mapping has been made. 15 clustered. The treatment centers, hospitals, treatment and referral centers. Hospitals were identified. 2 suspected were admitted to AHMC. Logistic and supply. Supply plan prepared. Critical supply and drug procurement on process. Available supply and drug distribution made to health facility for stock filling and readiness. Next actions: strengthening coordination, multi-agency coordination, MSC via PHEOC, enhanced surveillance at community and health facility, strong RCCE advocacy, use of streaming media, social media hotlines, logistic and supply building, funding and the resource mobilization. Next action: capacity building, comprehensive MEVD for frontline healthcare worker, case management training for 15 cluster treatment centers, total estimated training 90, comprehensive MEVD TOT training for all zones and towns, 241 healthcare worker training for media and communication professionals, November 26, 2025.